going to transition to our speaker. So I had the opportunity to see Dr. Rose speak a little while ago, and I immediately thought that she was a great resource and someone that I wanted to make sure that the entire brain injury community would be able to connect to and learn from. So I'm going to turn it over to my first question really is, if you could tell us a little bit about yourself, how did you get into the current role, and what brought you into kind of focusing on people living with disabilities?
Sure. Hi, everyone. Thank you so much for being here, and thank you, Lauren, for having me. I'm really excited to work with you all and have this chat today. So my name is Rose Reef, and I run Reef Counseling Services, which is based in Cary in North Carolina, but of course providing services across the state. I've always offered online counseling, but especially now with COVID, that's most of what I'm doing these days. So my background is I worked straight out of college. I went into a case management role, actually in Chapel Hill, working with individuals with both developmental and acquired disabilities. And I mostly worked with folks in an independent living setting. I ran an independent living department. And so in that role, I really saw firsthand that, the drop off that occurs basically after age 22, where most of the services open to young adults and teens with disabilities really just go away. And I recognized that mental health especially was a critical area where people's needs were not being met. And so after I had been in that case management role for about a decade, I decided to go back to school. I was really fortunate that within Carolina in the School of Medicine at UNC, there's a rehabilitation counseling psychology program. So I got a master's degree specifically geared towards helping people who have both disabilities and mental health conditions. And then I opened my counseling practice, really setting out just to work with adults with disabilities. But after I'd been in practice for about 6 months or so, I started getting a lot of calls from caregivers saying, I've tried to talk with other therapists about this, and I feel like they don't really get it. I feel like they think that I'm making too much of this, or that I'm worried for nothing. And I'd like to talk to you instead. So now, 7 or 8 years later, my practice is actually about 50-50 split between working with adults with disabilities like brain injury, aphasia, as well as developmental disabilities, things like autism and Down syndrome, and then working with caregivers, whether that's parents raising young children with disabilities, or spouses or other children who have a loved one who has sustained some sort of disability. So that's a bit about me and how I got to be here.
Perfect, and we're certainly glad to have you in the field. That's for sure. I also went to UNC Chapel Hill for that program, so that's awesome. Yeah. All right, so let's get started kind of talking. First we need to kind of define what we're talking about. So what is mental health? What is it? What does it really mean? What does it look like, and how is it different maybe for people living with brain injuries and caregivers?
Sure. So there's mental health and there's mental wellness, and they're connected, right? The steps that you take towards your mental health, with positive intention, encourage your mental wellness. But, the state of mental health for an individual, I think, is really more of an observational thing, in that you can say, right now, because of COVID, my mental health is suffering. I am more anxious than normal. My sympathetic nervous system is more engaged right now than it normally would be at this time of year, back to school time. I'm a parent, so yesterday was was a difficult first day back to school for us. So yeah, your mental health is a reflection of the things that you are actively doing, the systems that influence your life, your individual biology, your past experiences, the social environment you're living in, all of that coming together to contribute to your mental wellness, as it were.
Excellent. And so how would you say is that impacted after a brain injury? Is there like a science involved? Is it more kind of like adjustments, or do you notice like any sort of particular trends specifically related to brain injury and mental health?
Absolutely. I mean, most people's stories of how they sustained a brain injury are at a baseline level dramatic, right? It's unexpected accidents. It's, very serious, very intense, very quick medical conditions in most cases. And so that sort of primes people to be in a state of high alert and anxiety, because you can't tell someone who's just, had a stroke and now has an acquired brain injury that you're safe and everything's okay, because they've just lived an experience that negates that, right? So certainly people are more primed for anxiety, I find, in the immediate stages, and do experience more PTSD type symptoms where they're avoiding certain activities, they're having flashbacks and nightmares, both for the patient and for the caregiver. Those things can be true. And then over time, as people acclimate to, okay, these are the new, whether it's physical limitations that I have or relationship role dynamic changes that I've had as a result of, my disability after this incident, whatever it is, that's where we start to see depression setting in, sort of that I feel hopeless. I feel like no matter how hard I push myself in my rehab process, no matter how much I spend on adaptive products, that my life is never going to be the same. My relationships are never going to be as functional as they once were. And that's where we see, over the long term, depression start to set in. And for some folks, really unhealthy coping strategies, whether that's overspending, gambling, drinking, those kinds of things that they know are feel good in the moment, perhaps provide some immediate relief, but are ultimately negative, more so for their relationships or for their health. And so those are some of the longer term mental health consequences that we see.
Gotcha. So it definitely sounds like there's a difference between kind of those early after injury and how that might impact their mental health, and those later, in their rehabilitation process and what that looks for mental health. Do you tend to see the emphasis of, any sort of physical or medical stability kind of making mental health take a back seat almost, or what kind of impact would you see for particularly with individuals with brain injury?
Yeah, I think there's definitely, physical rehab tends to trump mental health. What I hear from a lot of clients, again, whether they're the patient who has had a traumatic brain injury or a caregiver, is, I realize that that's something I need, but I just can't do it right now. I don't have the time for it. I don't have the money. I don't have the, just emotional, physical space for something else right now. So I'm, either I've been encouraged by my therapists and my physicians to prioritize my physical rehab, or I have, elected that myself just because I feel I can't do it all. Which of course I'm biased as a mental health professional, but I do think that's really unfortunate. Especially with folks who've sustained brain injury, I often see the role of rest being really misunderstood for a lot of those patients and a lot of their caregivers. They feel that rest is a sign of weakness. And so for my clients who do come in sort of in the more acute rehab phase, I really try to work with them on flipping that script and seeing that rest is actually one of the most beneficial things you can do, not as a complement to your physical rehab, but really as a motivator, a push. It's something that makes your physical rehab more possible and helps you achieve more benefit. And I think that that's, probably an indicator of the culture that we live in, this push towards, always be achieving and moving on to the next goal. But, it's definitely something when I do have the opportunity to work with folks in that acute phase, certainly we work on anxiety and PTSD and those things that I just talked about, but also, complementing what the physical rehab folks are doing by providing some psychoed on brain recovery and neuroplasticity after injury, and really helping my patients to understand, how important it is that they don't fatigue themselves either physically or mentally or emotionally in that super important immediate acute recovery phase.
Yeah, I think that one thing that makes mental health and physical health maybe mental health a little bit more difficult to access is, physical health. There's a lot of things that you can see, and there's a lot of improvement that is so visible. You're not able to walk, and now you're using a walker. Now you're able to walk without, any sort of assistance, versus like mental health. We're talking about, self-esteem, we're talking about self-confidence, we're talking about self-concept and motivation and relationships roles. And so it can get a little bit murky. What impact, if any, do you see that when it comes to someone being able to engage in their mental wellness journey?
The impact of, sorry, can you ask the question again? I was a little.
Yeah. No,
Yeah.
no worries. So after a brain injury, someone typically might have a shift in their roles, in their self-concept. How might that impact, either accessing mental health treatment or maybe going through a mental health treatment related to a brain injury?
It's huge. And sadly, I have some real horror stories of, I've seen clients who will say, I tried to go meet with a therapist right after my injury, and I got there and it turned out the person's office was on the second floor and there was no elevator. And, it wasn't, they said their office was accessible, meaning that they have a grab bar in the bathroom, but I couldn't even get to the office, and just feeling so let down by that. And I've got dozens of stories like that from clients that I've heard, of just feeling like, whether it's a person's physical office space wasn't accessible to them, or that, the forms they were asked to fill out were so small that they couldn't, just their writing ability wouldn't let them do it, all sorts of things that I think really do reflect, unfortunately, that many mental health professionals don't have an understanding of how to provide adaptive services. And then that, of course, influences people's self-concept and makes them think, well, mental health can't be for me if I, can't even complete the forms or get into the office. So I do think that, my field has a lot of work to do in that way. But, as you said, sort of those concepts, self-concept and role dynamics, I mean, that's huge. And when people are in sort of the long-term, rehab, okay, they've sustain most of the improvements that they're going to. And now we're working on how do we rebuild life within, the context of their abilities now. That's huge stuff. And it's the little things. It's, I used to pay the bills and now I get too confused and I can't do that. I used to be the one to call the cable company to negotiate our fees down every 6 months or whatever. And now my voice is not to where I can be understood to make those phone calls. It's usually those little things that people don't even realize. And if you had asked them before the injury, they would have never said that's a key part of who I am. But I tend to see that those are the moments where people really start to question, who am I if I can't call the cable company for my family to save us the $12 every 6 months or whatever it is. And so I really try to focus with my clients and, with their family members where appropriate on, okay, how can we redefine this person's role? How can we make this still something that's important to them? I'm going to change some details to make things HIPAA compliant, but I remember one gentleman I worked with talked about every year on Christmas Eve, the family would gather and he would read "'Twas the Night Before Christmas." And he was really devastated after a brain injury that his speech just wouldn't let him do that this year. And he knew, and he was being encouraged by his speech therapist, but probably by next Christmas you'll be there, but right now just not going to be able to happen. And so, what he did instead was his family loved Disney. And so he found some version of The Night Before Christmas that was like read by Mickey Mouse or something. And he played that for the family and was there and, giving the kids all a little gift as that played. So, it was still grandpa leading the night before Christmas reading. It was just, somebody else doing the actual speaking for him that year. So finding little ways like that to help people maintain the things that are most important to them while letting go of the things that their disability just isn't going to allow them to do, I think is huge in helping people maintain their sense of self and purpose.
Yeah, I love that. I think that really poses on, you've posed on fatigue and you've talked about even systemic kind of changes within forms or, locations being accessible. And now, really just utilizing creativity to emphasize someone's independence and just feeling like they're a part of something. There's a large shift that can happen after a brain injury. And so trying to connect, pre versus post injury, because there's always tends to be a way that you can at least get a little bit of blend the two together, because you're still who you once were. and now you just may have a little bit of differences in challenges and things like that, but you're still you and still have a lot to give. So that's interesting, the story with the creativity. I like that. Continuing on the talk of mental health, we talked a little bit about anxiety and depression. Are there specific conditions that you see more often after a brain injury that, makes it difficult to kind of connect into the community and kind of do things that they once were able to do or trying to do related to their goals?
Sure. Certainly, a lot of people experience some types of PTSD symptoms. And with that, there's fatigue that comes from not being able to sleep and having nightmares. The discomfort of experiencing a flashback in certain conditions, but a lot of what I see is avoidance. It could be as simple as I just don't go out of my neighborhood this one way because that's where an accident occurred, or I don't use this bathroom in my house because that's where I had, the medical incident happened, whatever it is. But over time, that becomes really limiting. And again, influences a person's self-concept. How can I call myself strong and everybody's telling me I'm so brave and I'm a warrior, but I can't use my bathroom because I'm too scared. And so a lot of people come in wanting to address those types of symptoms. So, I'll typically take some traditional PTSD treatment strategies and we'll adapt them for the person. So that's one thing I definitely find myself doing a lot of with brain injury clients. And then, depression and anxiety are big ones. Just helping the person to, it's difficult with anxiety because again, they have experienced something so unexpected. So you can't ever fully honestly convince a person that, you are safe, but all you can do is remind them, these are the things that you have control over. Everything outside of that circle are things that you don't have control over. So how can we reduce our focus on the things that you couldn't change even if you wanted to? And how can we instead really zero in on giving you the confidence that you are as equipped and prepared as you can possibly be? And then build up your resilience to where even when those unexpected things happen, that you trust that, you know what to do to help yourself avoid having a panic attack. You know what to do to ask for assistance. You have the resources you need to communicate your needs to others, and thereby minimizing anxiety and, doing some actual exposure in the community is something I'll do a lot of with my anxious folks after an injury. And then, long term, it is more depression and sort of relationship management and, that feeling of, I want to be a spouse to my partner. I don't want to be the person that they care for. So how can we navigate that if realistically they're the only person who can meet my care needs, because of financial reasons or whatever else, but I don't want them to see me as, the person that they have to give a bath to. I still want them to find me interesting and sexually appealing. And, how can we find balance in those relationships? And then like I briefly touched on earlier, I definitely do see some folks after brain injury, because partly of impulse control issues, because partly of, negative attribution biases, we'll see people suffer with aggression. And verbal aggression, typically, sometimes physical, and also with unhealthy coping strategies. So whether that's drinking too much or turning to drugs and alcohol, gambling, those sorts of things. So I have worked with a number of clients over the years to adjust those maladaptive coping strategies and find healthier ways to deal with the uncomfortable feelings that they're having.
Yeah, it definitely sounds like, there's a lot of strategies that can be implemented. It might be really challenging to kind of access the help because it feels like you're weak or not strong enough or anything, but actually, seeking out those services and accessing those strategies makes you extremely strong. And it's very hard to do self-work and stuff like that. So I like how, talking about the individual and living with a brain injury and how that might present as, anxiety, depression, and trauma, post-traumatic stress disorder, PTSD. Do you see kind of those similar things in caregivers? And you mentioned aggression as well. I know that that's something that can really play a toll on those individuals that are caring for individuals with brain injury. Can you speak a little bit to kind of how that experience might be different, if at all?
Sure. It certainly manifests in different ways. They too may experience PTSD, but of course their experience will be, one of, I was waiting in the room, or they wouldn't let me go on the ambulance, that kind of thing. So, what I think is so interesting about caregivers in this population is if you look back at the research from like 20 to 30 years ago, so much of it was just focused on psychoeducation. There was this really firmly held belief that if we just teach caregivers enough about brain injury and what's going on, that their relationships will be okay and their marriages will be fine after this because they'll have the knowledge, right? And so they'll get it. And we know now that that's just not true. That to really meet their needs, they need a space to be able to say the uncomfortable things that feel true to them and to not be judged for it. Things like it would be easier in some ways if he had died in the accident, which, sounds so negative when you say it out loud, but if you don't validate that that's a truth that caregiver has at least mentally processed through, you're doing them a disservice by just giving them more and more pamphlets about, neuroplasticity and here's how the brain works. So I think for caregivers, whether it's in a support group or individual therapy or meeting with a spiritual leader, reading blog posts or TED Talks from other caregivers, however they get that need met, they need the validation to know that how they feel is not wrong and that they are not alone in feeling it. So I think that's tremendously helpful for caregivers' mental health. And then I think similarly, just having strategies, creative ways to continue to define the role. And then I think for them, a lot of the time too, seeing that their partner is making progress. Like you said earlier, Lauren, with walking, for example, it's so easy to see, well, this person went from not being able to take a step to using a wheelchair to now they're walking with a walker, now they have a cane, now they're mostly unsupported. That's progress, right? That's easy to mark. It's a lot harder when we're talking about emotional progress. And of course, when you have a relationship that, has already got 20, 30, 40 years of history behind it, it's really difficult to just stay focused on the moment and not bring up all the past stuff and resentment that can build over the years, of course, and to see where progress is happening. So I do definitely work with my caregivers, my caregiver clients on, realistic observation and staying in the moment, staying focused on, again, that sort of circle of control model that I talked about. What are the things within my circle of influence? Well, I can't control if my spouse gets food on her face during Thanksgiving dinner, but I can control if, I embarrass her by calling that out. I can control which side of her I sit on. I can control if I reach up and dab it off her face, that kind of thing. So seeing that, maybe the circumstances are going to happen regardless, but my influence is how I think and how I choose to behave in those moments. But knowing that feeling of, yeah, I hate that I have to wipe food off my loved one's face at Thanksgiving dinner. I wish that this weren't our reality. If you don't have the space to validate that emotional experience, all of the knowledge of what to do is almost wasted because that person needs to know that they're understood in that moment.
Yeah, I definitely think, making sure validating the negative experiences just as much as the positive experiences, because I think I've met a lot of, people that tend to, will hide it or bury it down or anything. And that's when, they're calling, asking for help because they don't know where to go. They can't do this anymore. It's too much,
Yeah.
and so with that kind of almost a breaking down moment, which many of us have from time to time, with or without a brain injury, just
Yeah.
the nature of circumstances. Can you talk a little bit about self-care and how that might influence? I think sometimes I feel like self-care is tough because you're always like, well, just do self-care, but it's not that easy.
No, it's not. I'm also a firm believer that self-care has got a really negative rap right now because it's been glossified. You know, it's been plussed up. When we say self-care, we all think of, you know, really expensive trips to the spa, and, you know, it's words like luxury and indulgence. The reality is that true self-care is the things that we do consistently without guilt, that it's almost, you know, it's automatic. We don't really think about it. You know, there are 71 people on this call right now. We all brushed our teeth today. Ta-da, that's self-care, right? It doesn't feel like it because it's automatic, and it's not something, you know, you don't feel bad if you say to your partner, hang on, I'm not ready to leave the house yet, I need to go brush my teeth. You know, but it is something that you do consistently that makes you feel better, that you know is influencing your long-term health. That meets the criteria of self-care. So I really try to break it down with my clients that, look, the things we're talking about, they don't need to be big. You don't need to book a mountain retreat for a week without your partner, because the truth is that'll feel good in the moment. Maybe you'll probably feel guilty while you're there, and be thinking about them and the alternate caregiver that you hired the whole time. But you're not going to feel the lasting effects of that a year from now or 2 years from now, right? So self-care is really about the things that you're consistently, almost habitually doing, that you don't feel like you have to ask permission to do. You know, the question that I get a lot is, what should I do for self-care? And I always turn that back around, because the truth is, what lights you up inside is unique to you. So self-care can look very different for many different people, right? For some people, it's, I need to go out, you know, every other week with my friend and have a cup of coffee and connect with that one friend that, you know, really gets me, and I feel understood and heard and better after that. Great, meets the criteria of self-care. Some people would say I need to do, you know, 5 minutes of yoga every day, and I just, you know, find a video I like on YouTube, and I do my quick little stretches, and that's it. Wonderful. You can commit to it. It's easy. It's guilt-free. You don't feel bad for taking that time. That's self-care. So I always encourage my clients, you know, whatever you think it is that you want to do, we need to get to where it passes the toothbrush test. You don't feel bad about taking the time to do it. You don't put it off, right? We would never say, I'm gonna just skip brushing my teeth all the days this week, and then on the weekend I'll brush them for 30 minutes to make up for it. We would never do that, because we get that why toothbrushing works is that it's consistent and it's habitual, and that's the benefit of it. So until your self-care passes the toothbrush test, you need to keep doing some work to get to where it just becomes part of the everyday routine.
Yeah, that's interesting. I like the toothbrush test. I'm gonna start thinking about things like that. And I think a lot of times with self-care, you know, it's being intentional about it too. It
Mm-hmm.
seems like, you know, you could be doing something for self-care, like you said, you know, something like brushing your teeth that you didn't even really know, but now it's like, if you're aware of it and you're intentional about it and you take that time, maybe, you know, do some breathing in between, you know, when you're washing, you know, that kind of stuff. So being intentional about it, I think, is really interesting. I think it's oftentimes that we see, you know, when I see self-care, it's always in the realm of caregivers, of those supporters, those carers. But what about self-care for individuals with brain injury? Is it, you know, is that something that also, you know, if you're living with a brain injury or working with someone with a brain injury, what does that look like, or is it similar?
I think it's similar. I think, you know, again, it's important to take the focus, I think, off a bit from just rehab. I encounter so many people who are so focused on, like, that's their new job, that's their new purpose, their mission in life is to, you know, get back to where they were as soon as possible. And so, you know, talking about who are you outside of your rehab efforts? What are the things that are meaningful to you? You know, maybe we still incorporate that into the rehab. I mean, if you loved to cook before, you know, setting aside one night a week where you're the one doing the cooking, and maybe your partner's there to help with certain things that you struggle with in the kitchen, but you're still reading a recipe, you're still using a timer. I mean, you're doing stuff that contributes to your rehab. But you're also doing it in a way that you enjoy, that isn't, you know, another worksheet kind of thing. So finding ways to marry those two, I think. You know, I try to work with my clients who have TBI on, you know, little moments and choices. You know, so much of mental health distress is related to a feeling of powerlessness. And especially after an injury or a medical incident that was outside of your control, it's easy to get stuck in feeling powerless. So even little things, like I'll say to my clients, have 2 bottles of shampoo, and one's just the regular everyday shampoo and the other one's the special day shampoo. And if you have a day coming up that's, important for whatever reason, or you're going to be challenged for whatever reason, wash your hair for twice as long and use the shampoo that you just really, it's more expensive, it smells better, whatever. And take that moment just for you. And nobody but you is going to know that you did that, right? Nobody can look at you and know, oh, they used the good shampoo today, but you'll know, right? And it's just those little moments of, I'm going to take the time, I'm going to think about the kind of day I want to have, I'm going to think about the choices that I do have the power to make that can influence how I feel about this day. I have one client who every time they come in, they've got a Starbucks, and it's, I don't go any other day, but the days that I come to therapy, I treat myself to a coffee beforehand because I know I'm doing good things for myself today. So making little ritual choices like that, I think, can be helpful towards self-care as well. Especially for the patients who maybe feel like they do need to devote most of their time and energy to rehab, but who want to still, get those reminders that they're worth it, that they deserve to feel cared for, that they deserve to feel good about who they are and the choices they're making even after an injury.
Excellent. And so we have a few more questions, but make sure that if you have any questions, be putting them in the chat box because we'll get to them right as soon as we finish up with the regular ones. So if there's any specific ones, feel free to write them in. And so I'm going to continue on. And I was thinking about specific, mantras or affirmations that maybe people find helpful, that maybe either professionals can pass on or individuals can use themselves, or caregivers. I know you've mentioned, think about your choices, think about what you can control. Are there any other kind of quick mantras or frame of mind that you tend to kind of, not like bread and butter because everyone's so differently, but a lot of times it can be just vague enough that everyone can kind of interpret it differently. Do you have any of those nuggets that you have to share?
Yeah, so with my brain injury clients especially, I do try to, give them some psycho ed on, okay, because of this injury, your brain is just now slightly more hardwired towards making those negative attribution biases, towards seeing the worst in people and situations. And so the question that I try to teach them to come back to is, what else could be true? To know that your first instinct may be one that is more negative than the situation, actually demands. And so in those moments where you feel yourself, getting frustrated with how people are talking to you, or thinking that people are seeing the worst in you, whatever it is, to say, okay, what else could be true? Sometimes in my office here, with clients, we'll actually do a role-playing exercise where I'll have them, play all of the participants of a situation that happened to try to think about, what else might somebody have meant by that? I had a client who got really enraged that a grocery store clerk had come up to him in the produce section and said, "Can I help you with anything?" And he was so frustrated, this kid, he thinks, I'm dumb just because I walk with a cane, and he thinks I can't read. He thinks, I can't do it. So he was having all of these really negative thoughts about this person. And so we said, okay, what else could be true? And then had him move to a different seat in the office, to role play. Okay, well, now you're the grocery store clerk. Why'd you ask that man if he needs help? We brainstormed a bunch of different reasons that may have contributed to why that happened. Maybe they just rearranged the produce section and nobody can find what they're looking for. Maybe he's in trouble for not taking enough care of customers, and he's supposed to ask everybody if they need help, whatever it is. So yeah, I think for my brain injury clients, especially, encouraging them to learn to ask themselves what else could be true of a situation, of other people, before they interpret based on their first instinct is one of the best skills I can give them. And it's helpful for caregivers too, if they're feeling anxious, oh, he's going to try to call the cable company and do that negotiation that we talked about earlier. It will never go well. Well, what else could be true? It could be fine, right? So if he wants to accept that, have that dignity of risk, and he wants to try, what's the worst that could happen? We have to call back later. That's actually not that big of a risk. We can handle that, and he wants to do it, so let's try. So I think for people to sort of rationalize through their immediate interpretations and fears, and consider what other possibilities might be available.
Yeah, that's definitely so. What else could be true? That's an interesting one there too. I think risk is a really big one when it comes to caregivers, and that's where I tend to see some people trying to keep their loved one kind of like in a bubble to
In the
prevent that
bubble,
risk,
yeah.
whether it's safety. It's like, this is what I know, and I don't want anybody else to come help. I know how to help them, you know. So that safety and risk, I think, is a really big one.
Yeah, yeah. And I'll
For
talk
that,
with
yeah.
caregivers who are in that space about, okay, 5 years from now, are you still going to be making him every cup of coffee and fixing every sandwich? And they'll say, well, no, 5 years from now, I won't be doing those things. And so it's, okay, well, how are we going to get there? Where can we start today to start to relieve you of some of this pressure that's, really, we know, coming from inside of you, that tells you that you're the only one who can do this? What systems do we need to put in place to help you feel more comfortable to let other people step in? And yeah, that question of risk, what's the worst thing that happens? The nurse aide doesn't make the sandwich exactly the way he likes. He may choose not to eat it. Is this really such a big deal? Is this an acceptable level of risk? In some cases, the answer may be no, but in many cases, the answer is yes. And so I oftentimes work with those caregiver clients through, okay, I have a worksheet that I'll do with them, like, what's the worst case thing that could happen? If that worst case thing happened, how much would that matter a week from now, a year from now, 5 years from now? And then what is actually most likely to happen? If the most likely thing happens, how much will that matter a week from now, a year from now, 5 years from now? And it's usually pretty easy for them to say that, again, like, especially after an accident or an injury of this kind, their brain is hardwired to be anxious. Anxiety is a helpful emotion because it helps us, predict and prevent risk and things that we should be fearful of. But teaching them that their anxiety is an overdrive, but that if they can think logically about what is, yeah, you can imagine that worst case scenario, but what's actually probably going to happen, it's usually an acceptable level of risk. And so teaching them that process to go through for themselves when they feel that anxiety spike, I think, is really helpful for a lot of the caregivers.
Perfect. Yeah, and we got a question that came in that I think it goes along really well with this conversation, so I'm going to put it in now.
Yeah.
But so we kind of just finished talking about, risk and making sure our loved one is safe. Kind of transitioning, so do you have any suggestions for how to help a family member that has a traumatic brain injury kind of help them discover their new self? This particular person has a daughter that is in their mid-20s, but, very childlike. So it's hard to really treat her as her age, and making sure that they're treating her, age appropriately. But, do you have any kind of suggestions for that kind of situation?
Yeah, if you're ever asking the question, how can we get this person to do X, you're asking the wrong question. Motivation to make change has to come from inside of a person. And even somebody whose cognitive functioning has been diminished because of an injury can still work with motivation to say, if this is the path to making a change, right? First, we don't even realize we want to make a change. Then we realize, something could be different, but we're not quite ready to do it. And now we're talking about when we're going to do it, and now we're ready to do it. Where are you on this path? What changes could be good for you to make? What do you want to have be different? And what little things can we do to start working towards it? Finding whatever it is that's motivating to that person. I'm working with a client now who's a caregiver whose loved one had an injury, and wasn't speak. They can speak, but they were choosing not to speak to anybody for fear of how they would sound. Well, they sort of tapped into this person's never before experienced love of horses. Now the person is going to horse camps and horseback riding where they have to talk because they have to interact with the instructor, right? The family member's not there on the horse with them. And it's really opened this person up and given them confidence. And now they're seeing that, like, they're starting to order for themselves in restaurants. So finding the things that motivate the person to challenge themselves, and then just kind of allowing that to happen, and seeing what happens, not pushing too hard to get the person to put the stamp on and say, yep, that was a success, but just sort of allowing some space for change to happen, I think is important. Does that answer the question?
I think so, yeah. So, and it sounds like with a lot of it that exploration process is key.
Mm-hmm.
So for that individual, it was horseback riding, and so you know, is there a way to kind of go through an exploration process of finding that motivation that kind of light someone up, and make sure it's age appropriate?
Sure. I mean, back before COVID, I would say just go to the library and browse. Um, but now it could be as simple as, let's look at your YouTube search history and let's see what are the things that you've been looking at and thinking about. What's been entertaining you? How could we take that and make it a broader interest? Whether it's working towards employment or working towards just building hobbies and activities, grabbing a book of, hey, here's all the classes that again, in non-COVID times, that the rec center is offering. What would you like to try? Maybe let's all put a bunch of ideas of things we could do together as a family in a hat, and every night we'll pick one and we'll do something, whether it's hiking in a new different place or playing a computer game all together online, whatever it is, little things that we can still do, even in the coronavirus world, just to see what interests the person. Sometimes just going for a walk somewhere and bringing a camera along and seeing what they take pictures of can give you clues, if the person isn't really able to verbalize as much of their internal experience. Just looking for what their natural inclinations are, and then thinking about how can we build on that. And sometimes it's true that relationships may get in the way of that. So, if the person sort of knows that mom and dad are always nagging me to try new things, maybe bringing in some kind of a DSP or joining a support group, or just setting up a date, with a friend to go do something together. Maybe just shaking up the dynamics of who's there can help to adjust some of the expectations. Because if they know that, my parents are always looking to push me to do new things and they sort of expect that, then that may get in the way. But if you can have it be under a new relationship dynamic, that may be helpful.
Perfect. Yeah, it's a lot of trial and error. Anything with
Yeah.
anything with life in general, but then particularly with brain injury, it's definitely something that we see is whether it's cognitive rehabilitation or strategies for de-escalation, or finding what motivates or brings someone joy. It's all just kind of trial and error and patience a lot of times for that.
And patience is huge. I think people have to a lot of people get very concerned with, it's the 1 year anniversary and I thought we would be at this place now, but we're not. And the more that you can, I think, coach caregivers and patients alike to, okay, sure, commemorate those dates, memorialize them. They're important to you. It's part of your story now. But try to avoid tying expectation to them, because when you do that, you're sort of setting yourself up for, that's outside of the circle, right? I cannot control where my speech will be exactly 1 year post injury. I can influence that through how much I'm doing my rehab exercises and how often I'm going to speech and everything else, but I cannot directly control it. So let's give up on the idea that there's any way that it should be. And instead just be observant of, this is where I was a year ago and this is where I am now. And I'm grateful that XYZ are true and I'm still working towards ABC. And it's a much, mentally healthier approach than the sort of idea that, 1 year from now, everything's going to be different and I'm going to be, fully back to work, or whatever the person's stuck on.
Yeah, I think that's so key, that rehabilitation process versus kind of like the end point. I think a lot of people get hooked on that end point, and it can be really,
Mm-hmm.
really challenging. And I think it ties back onto what you were talking about, how the brain kind of automatically turns it more to the negative instead of
Mm-hmm.
looking at the positive. And so, stopping those kind of thoughts before they start spiraling down and turn into that fear, that anxiety, the stress, potentially, depressive episode or anything like that, because you're not where you wanted to be. So stopping that kind of in its tracks and kind of looking at the positives, as hard as it might be, that can really just reframe your outlook.
Yeah. Or not even looking at the positives, but just looking at what is. Oftentimes, so often I talk to caregivers who say, I'm trying to focus on the positives. I'm trying to force myself to be positive. And why? Be what you are. One of my favorite tools that I'll pull out with caregivers is just a feelings wheel. And you've probably seen them posted on social media, where it's all these different colors and, there's like 3 levels of, okay, scared, but am I anxious, terrified, and it goes through like all these very specific, detailed emotions you could be feeling. And I'll ask the caregivers, well, where are you? Well, I resent that I have to do this now, but I'm grateful that, this is happening, and I'm fearful about this. And we'll go through, and it's like, okay, so you're literally all over the place, and that's okay. Be where you are. And if where you are is everywhere, that's okay. You can choose to say, I'm going to end each day by, reminding myself of 3 things that I'm grateful for, or 3 positive things that I did today. Good. Choose to end the day on a good note. But if you try to convince yourself that every day is only good, that's not reality. And the more that you try to, dull your negative and uncomfortable emotions, the more you dull all of them. And that's, again, kind of what contributes to feeling depressed and feeling anxious, because you feel that how you feel is wrong and isn't possible to be understood by anybody else. So I definitely try to encourage my clients instead, let's name all the feelings you're having. And instead of trying to just, put a magnifying glass on those positive ones, let's just let them all be there and acknowledge that it feels really uncomfortable to experience, feelings that seem like they should be in conflict at the same time. It can feel like a really ambiguous place to be, but if it's where you are, then be there. That's what it is.
Yeah, I love that. And it's actually making me think about, almost like I'm thinking about social media, and I'm thinking about, how Instagram is like, I think I read this, it's like, it's the perfect world, right? No one's gonna, post a lot of the negative aspects of it. There are a couple people that are, bridging that gap, but mainly it's, all perfection. And I think that's where a lot of people can get tied down, even, whether they're a caregiver or individual living with a brain injury, maybe their, high school friends or whatever are having babies and getting married and all this stuff. And maybe that's not where they are. Do you see an impact of social media for individuals?
Big time. There's, with brain injury, there's grief. Anytime we experience change, we experience loss. And with every loss, there's grief. So with the changes that come with a brain injury, there's grief. What I see a lot of is that grief tends to be cyclical. Like you said, if you have a child who's 18 and they're in a motorcycle accident, now they have a brain injury. Well, when all their friends are 22 and graduating from college, and you start getting all the invitations to the graduations in the mail, and you start seeing all the pictures on social media, for the parents, it brings it back up, right? It's right back in your face of, this was something I had expected from my child and it didn't happen. So again, it's that sense of lost expectation, right? So I definitely, encourage my clients, know your limits, know your boundaries. If you need to unfollow certain people, because it's graduation season or wedding season or whatever, go ahead and do that. Plan a retreat, or just lie and say you have some other commitment and you can't go to that graduation, and it's fine. And no one will think the less of you, or probably even notice. I coach a lot of my clients on the spotlight effect, that we all sort of believe that other people are paying more attention to us and more interested in our comings and goings and our motivation than they actually are. And I find that a lot of people are really encouraged to learn that concept and know that, oh, okay, people don't actually care as much about what I'm doing as I think that they do. And that can be really freeing when they need to take a social media break, when they need to step back from certain things, or just, I'm going to send a gift, I'm going to, write a nice note, but I'm not going to feel compelled to look at every picture of those kids in their cap and gown, because I'm sad that my child isn't going to have that experience, and that's okay. It doesn't make you any less caring of a person to have that feeling.
Yeah, it sounds like it's really kind of it's figuring out your boundaries and how
Mhm.
to implement them. And I think that's really similar to what we when kind of when you first started talking about was with fatigue as well, and understanding what that physical fatigue is. Are there other types of boundaries that people, have trouble setting or that can set kind of easily other than, related to social media and,
Mhm.
that kind of stuff?
For caregivers, it's the boundary of how much can you actually do, and how long can you sustain it for. Um, of knowing their limits, of knowing when they're experiencing caregiver fatigue. And I spend a lot of time teaching my clients about what that is, and what it looks and sounds like, and why it's important that they learn to recognize it in themselves. So a lot of times with my caregivers, I will, encourage them to come up with like a scale of like a 1 to 10, and just kind of throughout the day check in with yourself. Where are you at? On days where, maybe I'm at a 4, and I'm feeling stressed. I read something in the news that reminded me of my husband's accident or whatever. Okay, so we say, well, when you're at a 4, maybe, find an extra hour to take the dog for a walk. That's something you enjoy doing. And maybe limit, I'm not going to read the news after 7 p.m. because I find that when I do, it makes it hard for me to sleep at night. If I'm at a 6, I need to call my therapist and I need to see if I can get in for, a session sooner than my next one. If I'm at an 8, I need to, do this, and just figuring out what each level looks like in terms of what are the things that help me feel better. And help me to know that I'm meeting my own needs. But again, it's all based on that mindset, right? The caregiver has to really know and actually believe that they have to, put on their own oxygen mask first. If they don't, they will experience fatigue and resentment and caregiver fatigue, and they will not feel like they can keep going. And that's where relationships are really risked.
Yeah, that compassion fatigue is definitely one of those things that comes in very strong waves, and I like the scale that you mentioned when it comes to assessing fatigue, whether you're an individual with a brain injury or a caregiver,
Mhm.
because that kind of ties back to the, how physical kind of progression you can kind of put a
Mhm.
number on it, or have that. And so that's a way that you can put something that's kind of subjective or just not visibly seen, and you can
Mhm.
even see maybe throughout the week, what were your numbers, or anything. And I know there are a couple of different apps out there, and
Yeah.
maybe websites or blogs or something that do something like that. Is there something that you have seen that maybe stands out, or are you just hesitant about it all in general because mental health is something that maybe you need a little extra assistance from someone that's trained versus a computer screen?
So if there are apps that people can use as sort of mental health check-ins, Calm, Headspace, those are some of the more well-known ones. Those are great. The issue with them is they are all dependent on the person to be the one to initiate. So you have to know to go in there and say, okay, I'm going to rate my mood right now, and I'm going to choose to listen to a guided meditation or choose to do progressive muscle relaxation. Like, you have to be the one to choose to go in and do it. Um, there's one that I know of that's actually a clinical trial, but it just sends you random push outs throughout the day to say, what are you doing right now? How are you feeling? And asks a couple follow-up questions. That's the one that I've actually seen be the most interesting, because if you wait until a person is going to put it in, usually what you're going to see is the most negative and the most positive moments, with a bias towards the most negative moments. So you do get some helpful information about, okay, these are the times of days and maybe the location where the person tends to feel most anxious or most depressed, but you're not getting a really good depiction of the other parts of the day. So there's that. In terms of the like text-based therapy, um, if that's the kind of apps you're talking about, I know some great clinicians are using that. I have not seen any convincing um, research on the evidence basis of that, because counseling is so focused on relationship, and that safe relationship, that allowance to be able to say the things that you think nobody else is going to say. or hear without judgment is really so critical. And I just don't know how that could be accomplished through text, where there is so much, variance, and, words can mean different things depending on context, and without, being able to see a person and experience them. I had hesitation before I started doing telehealth, but, through reading the research and through my own experiences with clients, have become convinced that it is, a viable and beneficial treatment modality. But the text-based therapy, I'm just not convinced.
Yeah, I think that rapport piece is what, people typically, therapeutic rapport, just basically the relationship between, client and counselor is so key. And I think it's really hard, at least from what I've heard, for a lot of individuals with brain injury, particularly, to develop that rapport, whether it's difficulty with communication or, cognitive processing, especially if those systems aren't in place that you mentioned, like accessible forms or accessible office space or anything like that.
Yeah.
It's definitely that rapport is a huge piece, especially for people with brain injury. I have a question that came in. So what would you say to a caregiver that is really kind of overwhelmed with their son who has a traumatic brain injury and, wants him to be normal? There's a lot of excessive verbal abuse and property damage. What would you say to that kind of overwhelmed caregiver?
If it were me and they came to me, I would, if they're expressing their overwhelm, they are making a bid to be told to do something different that they don't have the self-confidence to do yet. So I would ask them questions along the lines of, how much longer can you continue to do this? What is your plan if the aggression does not improve and in fact gets worse? I would explore their fears. What are you afraid might happen in the future? And then I would, provide some context to say, some people choose to continue to care for a loved one who has a brain injury. These are some of the things that may happen if you choose that, and go through, some of the negatives, but also acknowledging that, you may feel less guilt. You may feel better, again, knowing that you're the one, that you can take it, quote unquote. So I get that that's what's holding you there. But to say, but other people choose to use these kinds of resources, whether it's respite care or a group home or, any other available resources, to try to reduce the strain on you and to, give you the ability to be in this person's life and caring for them longer, but caring for them in a different way. So it's sort of reframing, what is care? Is it doing the day-to-day tasks? But if that, puts strain on the relationship because there's a power dynamic issue, could it actually be better to step away from some of the day-to-day care and allow others to do that who don't have that, more dynamic relationship that you do as a parent? And to, instead choose to just focus on the things that matter more long term, whether it's providing assistance with their finances, but not, doing the daily bathing, that kind of thing. So I just try to have those conversations with caregivers and get them thinking about, if our daily roles were different, how might our relationship be different as a result? And, to give them the confidence to know that it's okay that they don't actually have that obligation to be the, primary hands-on caregiver, and to work through, the fear that they have about what might happen to their child and, all those kinds of things. I think many of us were raised with this belief that, good parents raise good kids, and whether your child is born with a disability or acquires one, it can be really hard to shake that mindset that, kind of, I don't want people to see my child being aggressive, even though I know logically it's because of an injury to their brain and it's not behavior that they're choosing. It can be really hard to let go of that idea that it doesn't reflect poorly on you as a parent, on their upbringing. And parents, I think, parents especially get stuck in that belief that, well, this is the hand I was dealt and I just have to shoulder it. And so I try to open them up gently to, you know, other alternatives that may be available, and to show them, or at least get them to be open to the idea that that could actually improve their relationship with their child, to, you know, pursue some additional supports.
Yeah, so it sounds like, you know, connecting to external resources as needed, and really just kind of having a conversation about, those boundaries almost like we mentioned before, and, you know, where they go from here. Sounds like that's kind of where that comes from. I think it makes me think of, you know, there's a lot of people out there, you know, like the things that we mentioned that make it really challenging to go and access some sort of counseling service, particularly. Is there anything that you tell people that are maybe hesitant, or, you know, not really sure what will counseling do? What does it look like? You know, it seems I don't want to lay down on a couch and, you know, analyze my dreams. Like, what, you know, are there any kind of debunked myths, or can you talk about that counseling experience for those that might be a little bit hesitant?
So I like to make the analogy that counseling has had a similar progression over the last 20 or 30 years to sushi restaurants. Like 20 or 30 years ago, I live in Cary. If you wanted to get sushi in Cary, there was one place you could go. And so you better like what they had to offer. But now, if you want to go out for sushi, again, when there's not coronavirus, you have lots of different options, right? There's like the romantic date spot, there's the place that's good for parties, there's the really authentic Japanese place. So within that idea of going for sushi, you can have many different experiences. And it's sort of about like, how do I find the one that best will give me the experience that I'm looking for? Counselors have grown up in very similar, you know, in a very similar way in that same space of time. Because it used to be that everybody was a generalist and everybody took whoever came to them and just sort of, you know, used their usual bag of tricks on that person, regardless of what their presenting issue was. Now we are all so much more niche, which I think really benefits our clients, because you can say, you know, I need to work with somebody who, you know, works with LGBTQ youth who are unsure about, you know, what college they're going to go to because they have social anxiety. There is a person that works with just that population, right? So they know all the resources that can help that person. They know all the tools and strategies, and it saves everybody a lot of time. So I would definitely encourage potential clients who are not sure about counseling to, first of all, know that the counseling world is maybe very different from how it's presented on television, you know, and in movies, where it's a sort of drab place and you're just expected to come and have things to talk about. That counseling is a much more dynamic field these days, and that you really can find a practitioner who meets your needs. If you're looking for somebody like, I just want to come in for a few quick sessions, be very solution focused, and, you know, kind of get some strategies, get out, yeah, you can get that. If you're looking for somebody like, this has been a rough road as a caregiver, like, I just want a place to go and vent, and, you know, if I want strategies, I'll ask for them, but I really just need somebody to listen, you can get that. So I would let people know that counseling is very much, it is what you make of it. So the more you can articulate what it is that you're looking for, the more you can have the experience that you're hoping to get.
Absolutely. I think that communication is key, and part of that kind of developing a rapport with your therapist. So even if it's like, you know, you're starting with a therapist and you're really not feeling like you're connecting, maybe they're not the right one, you know, making sure that you're, you know, try not to just push through it, because it's unless it's covered by insurance, which many they're, you know, not at least fully covered, you know, making sure that you're fully communicating that, or seeking out additional, you know, people that might be able to help. Like you mentioned, I'd never heard of the sushi analogy, sorry, but I think it's really good, because there are so many people out there, and you can go on, you know, Psychology Today. They have a whole, you know, website, and it seems like there's so many different little niches that are interesting. And one of the things that I think is going to be really beneficial, I think, almost with, you know, everything kind of going virtual, is that more people, you were already doing telehealth, so you're like, this is old news, but a lot of people are like, oh, let me figure out what this whole telehealth thing is. And, you know, I think that could be really beneficial to accessing even, counselors that you might not be able to if you're in Asheville versus, Wilmington or anywhere throughout the state. I think that could be really beneficial if, telehealth is something that you can do. So I think that's really good. I had another thought related to with a lot of people living with brain injury, they might start having kind of like mental health challenges, but professionals might just feel like, well, that's part of the brain injury and versus mental health. And I know we have a lot of professionals kind of on the call here, and then so I'm wondering if there's is there a way to kind of weed out when the mental health becomes disruptive or affecting affecting them more than just this is a brain injury, or when does it something that maybe seek out additional help? Do you have any thoughts on that?
Yeah, I mean, that diagnostic overshadowing can certainly happen after something as significant as brain injury. So I think all of us clinicians need to be sure that we're not just chalking it up to, well, that's just what happens. But really, if you're asking for sort of what's the litmus test for when is it a problem, it's a problem when the patient either self-reports that this is causing me distress, or the family members do, who are the ones observing the client. If they are unable to make that report, but it's clear from involved observers that there's a problem going on. I mean, anything, any disorder in the DSM, almost, that's the top criteria, is that this person's experiencing XYZ symptoms and it's causing them distress. So I think even if it is something inevitable, I have anger towards other people after a brain injury. Well, yeah, that's part of what happens after a brain injury, but we also know that there are effective strategies that can help to minimize the effect of that and give the person some impulse control skills to try to mitigate that. So, within the context of brain injury, let's work on that. Let's work on perspective taking and some of those types of exercises. Let's work on some impulse control, strategies to try to help this person be less distressed by, their what feels to them like instant anger that just comes out of nowhere. Although it may be tied to the brain injury, it was not a premorbid thing. That doesn't mean that we don't try to treat it, because if it's causing the person distress and they have hope that it could change, that meets the criteria for, let's try.
Excellent. Yeah. So, we're getting close to our 1:30 mark. So I definitely want to encourage any other questions. The questions that we've had have been so great. Thank you guys so much for putting them in. And I guess we'll just kind of transition to what your do you have a final statement or comment for individuals living with brain injury versus caregivers? Whatever you want to do to wrap this up, to if you had to tell somebody in an elevator speech to tie it in a bow, what should people kind of come away with?
That's a tough question. I guess to know that everybody's experience of injury and rehabilitation, or caring for somebody who's going through that, is unique. That you, as much as we all want to, kind of read the reviews of people's rehab experience, that may not actually be the most helpful thing, because everybody's biology, everybody's injury is different. And so your process through rehab and your emotional and mental resilience are unique to you. So if you read other people's stories and that's encouraging to you, great. But if it gets to the point that it becomes discouraging, because you feel like you're not where you should be, then it's time to stop looking at what others are doing, and instead being a more intentional observer of yourself. Again, with the physical stuff, it's really easy to see, in the beginning I couldn't talk, and now, I have 80% of my speech back. Well, that's fantastic. One of my favorite strategies that I use with people is around setting goals for themselves after they've acquired a disability. And I'll say, let's not just set one goal. Let's actually have like a good, better, and best goal. So like, if it's speech, it would be good to do 5 minutes of the speech exercise a day. It would be better to do 10 minutes a day, and it would be best to do 20 minutes a day. So even on the really hard days where you're just feeling, I'm too fatigued, I'm too exhausted, I can't do this, whatever the case is, even if you can still just do 5 minutes, that's still good, and then there will be some days where you can do the full 30. So giving people the flexibility that, it's not like pass fail, but that it really is more about, giving myself the allowance that some days are going to be better days than others. And I want to work within that, and not get down on myself if some days I can only do 5 minutes of whatever the thing is, but other days I can do more. And then, let's measure, like, how many days are you hitting that best goal? And you'll probably be pretty impressed with yourself if you keep data on that for like a month. That's really encouraging to a lot of people. So rather than reading everybody else's blog posts and watching everybody else's TED Talks and, all of that, really just focus on your own experience. And again, like, looking for what are the elements of this that I have control over. I'm going to double down on my efforts in those areas, and I'm going to try to not put as much emphasis on the things that I cannot control.
Perfect. And do you have any suggestions for professionals out there that are looking to either connect more with individuals with brain injury or, assist in their kind of mental health, mental wellness journey? Do you have any final thoughts on it for professionals?
Sure. I think, seeking out resources like this one through Brain Injury Association obviously is fantastic. Looking for additional CEUs that you can do. The Commission on Certifying Rehabilitation Counselors is a great one. There's MHDD is mental health and developmental disability, but they actually have some good resources and trainings towards brain injury. And then, just doing some of your own research, writing about it on your websites, opening, making it clear to clients that, hey, even if I don't have a ton of experience in this area, this is something I would like to be able to do more of. Asking people, do you find my office space accessible? Did you find my forms easy to read? Is this, are there changes I could make that would make it easier for you to come here and feel comfortable either in the space or, and online, whatever the case is. Just being open to adjusting your usual process, I think, is, really the definition of accommodation. So seeing what you can do to make your space, more accessible to people.
Excellent. We do have a question about, support groups or kind of, mental health in a group format. Is there a way to kind of increase that kind of attraction for members of a support group? How is it, make sure it's inclusive or more, I'm not sure how to word it, but, is there any ideas to attract kind of the promotion of support groups that you have?
Sure. So this is like a peer-led support group that we're talking about, or?
Yeah.
I think being really clear about, this is the mission and the values of this group. Even setting guidelines for, group member behavior. We're not going to tolerate this kind of thing. We're going to keep things confidential. I think having those kind of ground rules in a support group setting gives people the confidence to know that they are, again, coming into that place where it is okay to talk about these things. If you open, I think a lot of people want to be flexible and say, this is, just a place to come and share, and not feel as compelled to have an agenda. But I think that almost backfires because it feels unstructured. And without structure, without walls, you're not safe. So I think giving some clear structure and saying, this is a space where, caregivers who love someone with a brain injury can come, and on this day we're going to be talking about, shifting role dynamics and how to deal with the changes. And this week we're going to be talking about, when your spouse is aggressive toward you or towards other loved ones. Having really clear group rules and topics of conversation, I think it lets people know, oh yeah, that's a place for me. Kind of asking yourself, does my support group pass the caveman test, right? Could somebody spend 3 seconds looking at our web flyer or Facebook group or whatever and say, oh yeah, that's for me. If they don't immediately recognize that it's going to help them, you know how it is as a caregiver, you're going to be all over the place trying to find resources. And if it's too confusing and you have to do too much reading to figure out if it's going to help or not, you're just going to move past it. So, you know, having very clear graphics and words that reflect the words that caregivers actually use, I think is probably the best thing that those groups can do.
Excellent. Well, thank you so much. I really appreciate it. I think it's going to be really helpful, just all of the different talks, conversation and questions that we've been through. Again, appreciate everyone that put in questions. If you have any additional questions, let me know. You can also contact webinar@bianc.net and I can get them to Rose. Is there any other, how could people get to contact you, or can you talk a little bit about your services that your business that you own?
Sure. Yeah. So you can find me on the web at rosereef.com. Like I said, my office is located in Cary, but I have always offered online counseling. Well, not always, but past 3 or 4 years. And obviously now certainly offering a lot of online counseling to people in North Carolina. It does need to be in North Carolina. That's the only state where I'm licensed. So if people are interested in more about my services, you can visit me at there. And I have, services tabs for each of the groups of people that I work with, whether it's people with acquired disabilities like brain injury or spousal caregivers is how it's termed on my website, because that's most of who I see are spouses who are caring for a loved one. Within each of those services tabs, then if you scroll down, I have blog posts written for each of those groups of people. So some of the resources and strategies that I talked about today are in there. So you're certainly welcome to visit there. And if you or anybody you know would like to schedule a session, there's a button that just says schedule now. They're sort of throughout the website. You can just click there. It opens up my calendar. You can set something up, and the intake process is all done online. So try to make it as seamless and easy as possible for people. Yep.
Excellent. And I am going to I will transport this audio to written for anyone out there that wants it kind of so as accessible as possible for those individuals with maybe hearing difficulties or anything like that. So that will be posted on the Brain Injury Association of North Carolina's website, as well as a recording of this webinar. So if you missed anything or want to scroll back and watch it again, you can access that there. I'll try and get it up by next week. And you can also check out any of our other any other webinars that we have. If you go onto our website, www.bianc.net, and you can see we've got a webinar coming up in September, Therapy Without Borders, for you to be able to sign up. This is, totally free. It should be really, really good. And then in December, we have one on home modification and accessibility after brain injury. So it should be really good. So anyone out there looking for additional webinars or information, we also have our archived past webinars that you can attach to or check out too. So I really appreciate it. Thank you so much, Rose. This was wonderful. I hope everyone out there enjoyed it. I'm going to put out one other poll just to finish us out, whether or not you found this webinar beneficial. And then if you could definitely take a look at the survey and give us any sort of feedback that you have, whether or not you liked this kind of format with the interview style. Like I said, this was kind of our first one. I think it went swimmingly and my internet held up, which I am thrilled about. So I'll call it a good day from there, looking at those little things that what are. So thank you so much. I really appreciate it. I hope to see you guys at BIANC Virtual Camp at the next webinar. And thank you so much. Have a wonderful day.